Hi, my name is Selena Lupo, and this is my head-to-toe examination in a 360 of the room. And here's my videographer. Okay, so now before I begin, I would sanitize my stethoscope, do hand hygiene, and I would also don clean gloves if I had any. Now entering my patient's room. Hi, my name is Selena. I'm your student nurse today, and today we're going to be doing a head-to-toe examination. Does that sound okay with you?
Yes.
Perfect. Okay, and before we begin, can you state your name and your date of birth?
Emma Guerrero, July 15, 2003.
Perfect. Okay, and I would shut the drapes to ensure some privacy. Okay, so starting with general survey, physical appearance. Emma, can you tell me your age?
I'm 20 years old.
Okay, so my patient looks and appears her stated age. Her sexual development is also appropriate for her stated age. Moving on to body structure. Emma, can you stand up for me for a second? Okay, sit back down. So my patient's body structure is symmetrical, she's nourished, and there's no signs of physical deformities. Moving on to behavior. My patient's facial expressions appear relaxed. She's able to maintain eye contact. She's dressed appropriately for the situation, and her hygiene is well kept as well. Moving on to mobility. Emma, can I get you to stand up and walk 3 steps towards that way, and turn around, do the same, and you can sit down. Okay, so my patient's gait is steady balance with coordinated movements and symmetrical arm swings. Moving on to work of breathing. My patient appears in no signs of respiratory distress and doesn't have labored breathing as well. Moving on to neurological and eyes. Can I get you to state your name, where you are, and the month of the year?
Emma Guerrero at Seneca College, the month is November.
Okay, so my patient is alert and oriented to person, place, and time. Moving on to assessing cranial nerve number 7, the facial nerve. Emma, can I get you to smile, show your teeth, frown, raise your eyebrows, puff out your cheeks, and close your eyes while I attempt to open them. Okay, so my patient's motor functions were intact and had symmetrical movement, meaning that cranial nerve number 7, facial nerve, is intact bilaterally. Moving on to assessing cranial nerve number 3, ocular motor nerve, using PERLA. I'll start off with P. So I can see that my patient's pupil size is about 4 millimeters. E, they are equal bilaterally. R, they are round bilaterally, so no signs of anoscoria. I'll now go into R and L, which is reactive to light. So I'll be forming the direct and consensual light reflex. And I'll get you to look ahead. Okay, so my patient's left pupil was able to constrict upon direct light, and my patient's right pupil was able to constrict upon consensual light. Doing the same on the other side. Okay, my patient's right pupil was able to constrict upon direct light, and my patient's left pupil was able to constrict upon consensual light. Moving on to A, accommodation. Can I get you to stare at the tip of my pen while I bring it towards your nose? Okay, so my patient's pupil and axis of the eye was able to constrict and converge symmetrically and accommodate, meaning that cranial nerve number 3, ocular motor nerve, is intact bilaterally. Now moving on to ears, nose, and throat. So for ears, I'll be assessing cranial nerve number 8, acoustic nerve, using the whisper test. So from a 30-centimeter distance, I will whisper 3 2-syllable words in each of her ears. So Emma, can I get you to place your finger on your tragus and push in and out? Or repeat my words.
Happy, upset, popcorn.
And now for the other side.
Snowman, Christmas, candy.
Okay, so my patient was able to hear and correctly repeat my 6 words, meaning that cranial nerve number 8, acoustic nerve, is intact bilaterally. Moving on to inspection of the nose. I can see that my patient's nose is in the midline, and now I'll assess for patency. Emma, can I get you to place one finger in your nostril and breathe in through the other? Same on the other side. Okay, so my patient's nose is patent. Moving on to assessing cranial nerve number 9, glossopharyngeal, cranial nerve number 10, vagus nerve. Okay, Emma, so I'll get you to open up and say ah. Okay, so my patient's uvula and soft palate were able to rise, meaning that cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus nerve, are intact. Moving on to the peripheral, vascular, and musculoskeletal systems. Okay, so upon inspection of the arms, I can see that the color is uniform with the rest of the body. Hair distribution is even. They're symmetrical. There's no scars or lesions. Moving on to palpation. Let me know if you feel any pain or tenderness.
No.
Okay, so upon palpation, my patient doesn't feel any pain or tenderness. There was no moisture, texture was smooth and soft, and I'm now palpating for temperature using the dorsal portion of my hands. Okay, so my patient's temperature was warm to touch bilaterally. Moving on to capillary refill. My patient's capillary refill was less than 2 seconds, which indicates normal findings and good circulation. Moving on to palpating the radial pulses, I would count to 30 seconds and multiply by 2. Okay, so my patient's radial pulses are 68 beats per minute, regular rhythm, 2 plus strength, and equal bilaterally. Now moving on to the brachial pulses, I would do the same, count for 30 seconds, multiply by 2. Okay, so my patient's brachial pulses were 68 beats per minute, regular rhythm, 2 plus strength, and equal bilaterally as well. So now for range of motion, Emma, can I get you to repeat my actions? I'll have you put your hands out, bend your wrists back. This is flexion, up. This is extension, bring them in and like this. This is radial deviation, and out. This is ulnar deviation. Any pain or tenderness?
No.
Okay, now for elbows, can I get you to bring them out? This is extension, and bring them in. This is flexion, like this. This is pronation, and up is supination. Any pain or tenderness?
No.
Okay, now for shoulders, can I get you to bring them up? This is abduction and down. This is adduction, like this. This is external rotation, and like this is internal rotation. Any pain or tenderness?
No.
Okay, and now for my hands, can I just get you to squeeze as hard as you can? Any pain or tenderness?
No.
Okay, so my patient's range of motion was full with coordinated movements, grade strength of 5, no signs of pain, tenderness, or crepitation. Moving on to inspecting the legs. So upon inspection, I can see that my patient's color is uniform throughout the rest of her body. Hair distribution is even, they're symmetrical, no lesions or scars. Moving on to palpation, let me know if you feel any pain or tenderness.
No.
Okay, so my patient feels no tenderness, I didn't feel any moisture, texture is smooth and soft, no masses, and now I'll feel for temperature using the dorsal portion of my hands. Okay, so temperature is warm to touch bilaterally. Moving on to capillary refill. In a real world setting, my patient wouldn't have her socks on. Okay, my patient's capillary refill was less than 2 seconds, indicating good circulation and normal findings. Now moving on to palpating the posterior tibialis pulses simultaneously. I count for 30 seconds and multiply by 2. Okay, so my patient's pulse was 68 beats per minute, regular rhythm, 2 plus strength, equal bilaterally. Now assessing for dorsalis pedis pulse. Okay, so after counting for 30 seconds, multiplying by 2, my patient's dorsalis pedis pulse was 68 beats per minute, regular rhythm, 2 plus strength, and equal bilaterally. Now moving on to range of motion, can I have you stand up and repeat my actions? So have you bend down, touch your toes. This is flexion, come back up. This is extension. Have you bend to your left? This is left lateral bending to your right. This is right lateral bending. Twist to your left. This is left lateral rotation. And to your right, this is right lateral rotation. Any pain or tenderness?
No.
Okay, now you can sit down. So for your knees, can I have you bring them up? This is extension, drive them back. This is flexion. Any pain or tenderness?
No.
Okay, now for your feet, I'll have you push down. This is plantar flexion and bring them up. This is dorsiflexion. Any pain or tenderness?
No.
Okay, so I would do hand hygiene after touching my patient's feet. Okay, so for range of motion, my patient has a full and coordinated range of motion, grade strength of 5, and no signs of pain, tenderness, or crepitation. Now moving on to assessing the posterior thorax. So can I have you turn around? Okay, so upon inspection of the posterior thorax, I can see that my patient's thorax is symmetrical. There are no skeletal deformities, lesions, or scars. And now I will begin to assess for the anterior-posterior transverse ratio. So this is 1 hand and 2. So my patient's anterior-posterior transverse diameter is a ratio of 1 to 2, which indicates normal findings. Moving on to palpation of the posterior thorax, let me know if you feel any pain or tenderness.
No.
Okay, so upon palpation, my patient doesn't feel any pain or tenderness. I didn't feel any masses, there was no moisture, and I'll now assess for symmetrical chest expansion on T10. So Emma, can you take a deep breath in and out for me? Okay, so my thumbs were able to move apart symmetrically, meaning that my patient has symmetrical lung expansion or chest expansion. Now moving on to auscultation of the posterior thorax. So I'll be using the diaphragm of my bell, diaphragm of my stethoscope. So Emma, every time my diaphragm touches your back, I would like you to take a deep breath in or out and let me know if you feel any dizziness at all. 1, 2, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 8, 9. Okay, so upon auscultation, I didn't hear any adventitious sounds or crackling of the lungs. My patient's respiratory rate was 12 breaths per minute with a regular rhythm and no labored breathing. I heard bronchiovesicular sounds best throughout T2 to T4. I heard vesicular sounds best throughout the rest of the thorax. And I would hear brachial sounds best throughout the anterior thorax and larynx. Now moving on to assessing doing a cardiac assessment. Emma, can I get you to lay on the table? Okay, so for auscultating the cardiac assessment, I will be auscultating all 5 valves using the diaphragm of my stethoscope. So starting in the second intercostal space on the right sternal border is the aortic valve. Moving on to the second intercostal space in the left sternal border is the pulmonic valve. Moving down to the third intercostal space on the left sternal border is the Erb's point. Moving to the fifth intercostal space on the left sternal border is the tricuspid valve. And then the fifth intercostal space in the left midclavicular line is the mitral valve. Okay, so upon auscultation, I heard S1 sounds best at the apex of the heart or the mitral valve. I heard S2 sounds best at the base of the heart or the pulmonic or aortic valve. Now I'll be auscultating for the apical pulse rate. This is found at the fifth intercostal space in the left midclavicular line, and I'll be listening for a whole minute. Okay, so my patient's pulse was 68 beats per minute, regular rhythm, and 2+ strength. Now assessing for any murmurs or S3, S4 sounds using the bell of my stethoscope and the same 5 valves. So starting again in the second intercostal space on the right sternal border is the aortic. Now the second intercostal space on the left sternal border is the pulmonic. The third intercostal space on the left sternal border is the Erb's point. Fifth intercostal space on the left sternal border is the tricuspid. And fifth intercostal space in the left midclavicular line is the mitral. So upon auscultation with my bell, I didn't hear any murmurs or S3 or S4 sounds. Now beginning to assess the abdomen. So I would first start by draping my patient, exposing only her abdomen. So upon inspection of the abdomen, I see that the umbilicus is in midline, the color is uniform throughout the rest of her body. It is symmetrical, there is even hair distribution, and there's no irregular pulsations or peristalsis. So starting with auscultation of the abdomen prior to palpation. I'll use the diaphragm of my stethoscope, and I'll start in the right lower quadrant of the abdomen. Moving to the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, so upon auscultation of the abdomen, I didn't hear any adventitious sounds. I heard high-pitched sounds with gurgling and cascading sounds occurring every 5 to 30 times per minute. Moving on to light palpation of the abdomen, I'll again start in the right lower quadrant in circular motions. Moving to the right upper quadrant, left upper quadrant, and left lower quadrant. Emma, did you feel any pain or tenderness?
No.
Okay, so upon light palpation of a patient's abdomen, my patient didn't feel any pain or tenderness, and there was also no rigidity present. Finally, moving on to light palpation of the bladder, I would palpate 5 centimeters above the pubic symphysis and below the umbilicus. Any pain or tenderness?
No.
Okay, so upon palpation of my patient's bladder, there was no pain or tenderness felt, and that concludes my head-to-toe examination.